What symptoms can I expect from an AVM?
So many AVMs can remain silent for a long period of time, and we've previously talked about how the average age of AVM diagnosis is middle age. So that means many patients are walking around with AVMs for decades without knowing that they have an AVM. And in some instances, it's possible for patients to live their entire life with an AVM and never know about it if the AVM doesn't bleed or cause any symptoms. But when we talk about AVMs that cause symptoms, there are three main categories of symptoms that we see in this patient population. So the first category is patients that have headaches. So we all have headaches from time to time, tension headaches, migraine headaches, but AVM headaches typically are chronic headaches. They occur all the time. They occur consistently on a daily basis. They don't necessarily come and go. And the rationale for these headaches in AVM patients is perhaps thought to be related to the high blood flow through the AVM vessels. So the pipes of the AVM that have a lot of blood flowing through them create a lot of tension in the blood vessels, and that's potentially thought to be the cause of headaches. A second main category of symptoms in AVM patients are seizures, and seizures occur in about 1/3 of AVM patients. They are thought to be related to changes in blood flow between the AVM and the surrounding brain, or perhaps irritation of the brain from the AVM itself or old blood products from the AVM. So if a patient has a seizure, they typically undergo an MRI scan to determine the cause of the seizure, and this is how an AVM can be discovered in this subset of patients. The final group of symptoms are what's called progressive neurologic deficits, and these are AVMs that cause gradual symptoms such as weakness or numbness or speech difficulty or perhaps visual difficulty. And this is obviously related to the location of the AVM. It's thought to be related to potential blood flow through the AVM to the point that so much blood is going through the AVM that very little blood is going to the surrounding brain tissue. So the surrounding brain tissue does not get as much blood as it normally should. It gets much less, and the surrounding brain tissue essentially is starving for blood, and that can cause that tissue to result in a deficit for the patient. So if a patient starts developing kind of chronic speech difficulty or starts developing gradual onset of progressive weakness and numbness in their arms or legs, that could potentially be related to an AVM.
If you like this video, don't forget to subscribe.